Hi, my name is Maria Uribe. I'm in my school scrubs. This is my student ID. I'm going to be doing the precautions video for prenatal. Today, I want to start off discussing certain foods that should be avoided during pregnancy. The first set is unwashed or pre-cut fruit, vegetables, and unpasteurized dairy. Deli meat and cheese can lead to listeriosis, which causes miscarriages. Second set would be unwashed fruit and vegetables, and undercooked meat can lead to toxoplasmosis, which leads to fetal blindness and even fetal brain damage. Undercooked meat and raw or undercooked eggs can lead to salmonella poisoning, which also causes miscarriages. You want to avoid any food containing mercury as it can infect the baby's nervous system. High doses of caffeine can cause low birth weight. Miscarriages for over-the-counter medication, you just want to avoid all of that during the first semester if you can. This is the time that the baby is at the highest risk for any damage. It's also recommended to speak to your physician before taking over-the-counter medication, supplements, and of course prenatal supplement, folic acid, things like that are not only safe but recommended for the patient. If you're having weight gaining problems and the physician is worried, there are protein powders and drink supplements that can boost your caloric intake during pregnancy. There are medications that are strongly contraindicated during pregnancy also. They're called tetragenic drugs. They can cause severe birth defects and also miscarriage. There are medications, retinoids, medication, ACE inhibitors, ARBs, lithium, oral contraceptives, and 3 common environmental exposures to avoid are extreme heat, such as hot tubs, saunas. They can cause severe neural tube defects as well. The second one is cat litter boxes. This can expose you to toxoplasmosis. As I said before, it can cause you the fetus blindness and brain damage. It can also cause stillbirth. The last one, radiation. So high dose X-ray can lead to miscarriages. And alcohol, tobacco, any substance use. All that needs to be completely avoided during pregnancy. Alcohol can lead to fetal alcohol syndrome, which can cause growth abnormalities, mental disabilities, abnormal facial features, and tobacco. Any smoking can have harmful chemicals in it, such as nicotine, can cause permanent damage to the baby's lungs and brains. It can also lessen the oxygen, decrease oxygen supply, nutrients to the baby from the mom, and it can place her at risk for increased bleeding. Substance abuse. Substance abuse for the baby can be caused by placental complications, severe birth defects, neonatal withdrawals. For the mom, it's important for her to address any anemia or infection, hepatitis, be safe during traveling, pregnancy. If long distance traveling, it should be avoided, or speak to your physician before traveling. Make sure there are no complications for your pregnancy or a reason to be sitting during travel. It can lead to DBT, where your lower extremities avoid getting up and move around. You need to get up and move around as much as you can, wear compression stockings, stretch your legs, your ankles, know the signs and symptoms of DBT, make sure you have adequate fluid intake, drink enough water. Safest time to travel within a pregnancy is the second trimester, and the first trimester can cause spontaneous abortion. The third trimester, hypertension or preterm labor. So prepare for travel. If you want to know your blood type, you definitely want to know your blood type. Avoid any vaccines such as typhoid vaccine, live vaccines. Avoid tropical islands or developing countries because it can expose you to Zika virus, mosquitoes. The dentist, seeing the dentist during pregnancy is highly recommended because you can cause issues during pregnancy. Your dental issues during pregnancy can be due to hormonal changes since you're pregnant. A pregnant patient can have increased infections, and due to diet and cravings, it can increase cavities, and the dentist make sure to see you by the second trimester or third trimester. Avoid laying on your back for long periods of times. You want to avoid x-rays. When you're going to the dentist, and procedures that are safe would be filling crowns, anesthesia with epinephrine. And that concludes my precautions video. Thank you.